Hi, I'm Leon Lovelace, and this is Unstoppable Force. I got a news story for you, and it's from The Guardian. It's about how Rwandan robots, or robot drones, are saving lives. Alright, an ingenious drone delivery service known as Uber for Blood has slashed the delivery time of life-saving medicine in remote regions of Rwanda from 4 hours to an average of a half an hour. Partnership between Zipline, a Silicon Valley robotics company, and the country's health ministry has delivered more than 5,500 units of blood over the past year, often in life-saving situations. Never before have patients in the country received blood so quickly and efficiently. While commercial drone delivery in wealthier countries is still at the testing stage, hampered by busy skies and strict regulations on airspace, Zipline is delivering blood to 12 regional hospitals from a base in the east of Rwanda. Each hospital serves about 500,000 people. And there's an important fact about that down later in the article. The use of drones is helping to reduce maternal deaths, a quarter of which are the results of blood loss during childbirth, and high incidences of malaria-induced anemia, which is common in children. Drone delivery also means hospitals can store less blood, which means less waste as blood spoils quickly. So I wasn't really aware of this, about blood not lasting that long, so they should also talk more about that in the United States and when they're having their blood drives and that sort of thing. Because if they let the public aware of that, maybe people would give blood more often. Now, Zipline plans to work with the government in Tanzania, a country of 56 million people, to launch what it claims is the world's largest drone delivery network. Keller Ronaldo, Zipline's co-founder and chief executive officer, said the move will make East Africa a world leader in drone logistics. I guess it also makes Zipline also the biggest beneficiary of that drone logistics, because they're the company behind those drones. So don't discount the fact that Zipline's making a big profit, at least a fair profit, off of being in here delivering these drones for all these people over in Rwanda. Because if the US government actually gave a shit about people in Rwanda, they could have just came in and just pretty much gave some drones over to Rwanda's government, and had them show them how to operate them, and really be to deliver these with very low cost, because the U.S. government wouldn't be doing that for profit, but to actually help the Rwandan people get health care they need. So I'll skip down a little bit. This year, the firm aims to deliver a range of medical products, including blood transfusion supplies, HIV medication, anti-malarials, sutures, and UV tubes to 4 bases in Tanzania, supporting more than 1,000 clinics. So this is all and good, but check out this short paragraph right here. Critics of the scheme in Rwanda have questioned why the authorities have invested in high-tech supplies when demand for basic infrastructure, roads, and health centers, which is a key one, health centers, still exceeds supply. Zipline and the government had not revealed the cost of the project. And of course, they haven't revealed the cost because he probably spent hundreds of thousands, if not millions of dollars, developing this network to supply these health centers with some medical supplies, when they at least should have developed health centers and hospitals first. Because of course, each hospital serving 500,000 people is not really the most efficient way that a hospital is going to be able to serve the people of that area or of that region. So this is all good that they're doing this, but they really need to get on some of the basic infrastructure first. And here's why sometimes you don't want companies or corporations going into other nations and trying to provide services, because they're going to have them put services in something else that's not going to be the most efficient way to help the citizens of that nation.